Hi, everyone. I'm Cameron Meyer, and I serve as the National Campus Youth Engagement Team's Advocacy Chair. I'm excited to have you here today to talk with two amazing people, Caroline and Ian. You may be wondering what exactly is the American Cancer Society Cancer Action Network, ACS CAN. Well, the organization is the advocacy affiliate of ACS that seeks to advance the ACS mission through policy at the local, state, and federal levels. ACS CAN is membership based in a nonpartisan organization seeking to appeal to all lawmakers. We depend on our volunteers throughout 435 congressional districts to push legislation that aims to eliminate and alleviate cancer suffering. Ultimately, ACS CAN depends on relationships between the lawmakers and volunteers like you. Caroline, a federal lobbyist for ACS CAN, will give us an example of how these relationships have effectively helped us further the ACS CAN mission. Caroline?
Hi. Hello, everyone. As Cameron said, I'm Caroline Powers, and I am a federal lobbyist for ACS CAN here in Washington, D.C. I work every day to try to influence policy and policymakers to make sure that the voice of cancer patients, survivors, and their families are heard on Capitol Hill and in the White House. One issue that I work on is increasing federal funding for cancer research at the National Institutes of Health, or the NIH, and the National Cancer Institute, or the NCI. The NIH funds the research at labs around the country that leads to new treatments and ways to prevent disease. The NCI is part of the NIH, the part that focuses on cancer research specifically. So every year we make the funding of biomedical and cancer research at the NIH and the NCI a priority for ACS CAN. This year is no different, but the need is even more urgent because of COVID-19. Right now, we're advocating that Congress provide funding for the NIH to restart research and clinical trials impacted by COVID-19. Because of the pandemic, the NIH has delayed and lost as much as $16 billion worth of research. And without funding to make up those losses, those research projects could be lost forever, which, from our perspective, is a nightmare, really, to think of that next great idea, that aha moment, really being lost and stuck on a shelf somewhere because of a lack of funding. So right now, Congress is talking about doing another emergency package that would include a whole bunch of different priorities. And we're working to ensure that NIH is part of that package. However, at the same time, we're also making sure that members of Congress and their staffs understand that every year we need to make sure that federal funding for cancer research is sustained and meaningful. So we continue to make the case through emails, phone calls, meetings, testimony, and every other tool at our fingertips. But none of this work gets done without volunteers like all of you. By becoming a member of ACS CAN, you become part of a community of people working to make change in your neighborhood, in your community, but also across the country. You'll receive training, you get help to develop advocacy skills, along with you will develop relationships with lawmakers and even lifelong friendships with other volunteers. But we need you to get our work done and to influence the policy that's happening in Washington, D.C. So I hope you'll all consider becoming a member of ACS CAN after this event. So back to you, Cameron.
Yeah, thank you so much, Caroline. Another individual driving true change in the fight against cancer is Ian, a cancer survivor, ACS CAN volunteer, and a PhD student studying cancer biology at Duke University. He will talk with us about his cancer story and his research.
Hi, Cameron. Thank you for the introduction. So my cancer story really started like many people's. I think cancer is something that comes into your life, and it doesn't come in a small way, and my life was no different. And I was diagnosed with osteosarcoma when I was 16. So for a lot of people, when they're 16, they're kind of just starting out, they're getting their driver's license and kind of understanding what freedom and control and what they can do with the rest of their lives. Like they're kind of starting to define that. And my diagnosis was devastating for my family, particularly. I think it's really, really hard on families and my younger siblings. And I think that it was that lack of control and understanding that really drove me to join the ACS and the ACS CAN when I was in high school to start doing everything that I could to take back some of that control and take and understand the disease that I was diagnosed with and what I could do for other people that were put in that position. So I started my volunteering with ACS CAN actually in this at the state level, meeting with representatives. I met with my grassroots manager an hour before my first meeting, and we had breakfast. And I just thought, I have no idea what I'm doing. I am 17 years old, and this representative is just going to look at me and think, what is this high school student understand about what legislating is like at the national level? And I don't think it could have been farther from the truth. And he sat there and he listened to my story and understood the impact that cancer can have, not only on my life, but the lives of my brothers and sisters and cousins and even close friends. So it was really in that moment that I kind of understood everything that advocacy could do, not only for myself, but for all of the people around me. So I continued volunteering. I volunteered with my Relay for Life in college and at the national level. I kind of continued through college. And after I graduated college, I really understood that like I wanted to impact cancer in as many ways as I could for the rest of my life. Like that's what I wanted my career to be. So I joined a sarcoma lab at the University of Utah and then applied to PhD programs where I'm now studying sarcoma at Duke University, studying mouse models of sarcoma. And it was kind of throughout this time that I've had a lot of different roles with the ACS and with the ACS CAN. I've been a volunteer in districts in 4 different states. I've been to the state lobby days for 4 different states. I've been to the national lobby day 3 different times. And I've spoken with lawmakers from across the country, from my own state to kind of other states that were looking at passing bills that would have impacted my life or kids like me. And it's through these experiences that I've truly come to understand what a singular person can do in this fight when they have the backing of an organization like the ACS CAN and other volunteers. You know, I think that there's something to be said about an individual voice really making an impact, but it's really like the movement of ACS CAN and the connections and all of the knowledge that all of the volunteers and staff from the local to the state to the national level bring to these conversations that allow us to have an impact. And I think that's even become more apparent now. So I do research in a really specific disease. Sarcoma doesn't affect that many people, and I really it's through the ACS CAN that I get to work on other initiatives like screening and kind of restricting tobacco to students that I have known and kind of experiences that I've had. And it's working on those other initiatives that you really understand how the cumulative effort that you have can really impact a lot of different facets of the disease. So I think it's through the ACS CAN and my own research and fundraising through the ACS that I really feel like I make a difference, and I make a difference not only to like in the lives of cancer patients who get rides and researchers, but really kind of in the lives of my family members when we talk about these things and how important they are to, you know, talk about what tobacco is to teens and legislators and understand how peer pressure works. And so, yeah, I mean, I think I've had a really interesting and diverse career with the ACS CAN in various roles, and I've really been fortunate to have some really personal meetings with lawmakers and have never felt like in those conversations, or either as a high school, college, or PhD student, whether my opinion wasn't valued as a part of that conversation. And I think ACS CAN prepares you for those conversations and also a lot like puts you in the best position and in the room to have those conversations. So yeah, I think that's my experience both as a volunteer and a researcher.
Thank you so much for sharing your story, Ian. So we will now be transitioning into a Q&A with you both, and we encourage you, the audience, to add your questions into the chat. We know you guys have a lot of questions for these two amazing individuals, so let's get right into it. Caroline, where are we in the process now? How does Congress decide on government spending, and how can regular people impact this process?
Sure. So we are sort of at the beginning of the process. It typically kicks off with the president introducing his budget. This year, the budget introduction is delayed. We have a new president, and it often is delayed when we have a new president. So we actually expect the president to release a version of his budget next week. That will kick off a series of hearings, markups, and then this summer we could start seeing some bills in the House, and then later in the fall in the Senate. And the impact that we can make now is really incredible, because it's members of Congress are currently putting together their lists of priorities, what is most important to them, and then they're going and bringing those lists to the relevant committees. In this case, it's Appropriations Committee, and saying, I've heard from constituents back home that this is important to them, and therefore it's important to me. And there are a lot of really important and programs that get funded by the federal government, but it's sort of those personal stories when it comes to cancer research that really make the difference and sort of bring it back home to members of Congress, so that they understand that, people are alive today because of cancer research. We've made such strides in progress in cancer, but without federal funding, that just doesn't happen. So we're at the beginning, and this process sort of will go forward throughout the year. So it's making the contacts with lawmakers throughout the year, and really highlighting the importance of cancer research and why it matters to you. Or tobacco. We had a bill actually introduced today that we support called Quit Because of COVID, which is a bill that would make tobacco cessation products covered by the Medicaid program. It's a really important bill. And that was just introduced today. So now we're going to be working to get co-sponsors for that. But it's throughout the year. Congress sort of is a January through December body at this point. So we really do need to have folks weighing in throughout the year.
Thank you. Ian, why should students get involved with ACS CAN and with this campaign specifically?
Yeah, so I think students in a lot of these campaigns are the ones who are impacted. So tobacco is, vaping is on the rise in students and adolescents, and we don't necessarily know all of the impacts that we have, and a lot of the research is still ongoing, but we know that it's not good for you. And I think that that's like really important, and I've had these conversations with even my own siblings. And it's kind of in those conversations that I understand how prevalent this is in their social lives, in their social circles, and how much they don't really talk about the impact that some of these practices can have on their lives. And I think when we get involved in legislative processes, you learn more about how kind of incredibly impactful some of your own decisions can be on kind of your future health and your friends' future health and your family's future health. And you also learn more about what you can do about that in your community. I think, a big reason why the decrease in like overall cancer mortality is how much we learned about smoking in the last 25 years. And I really don't want to see, kind of younger people in 25 years when you look back and think, wow, I wish I would have understood the impact of vaping on my own life. And I didn't just see it as a social practice that, was something that I was going to think about in the future as kind of a future impact. So I think that's, it's important to understand and be involved and kind of get to know why these things are important in your life and kind of to advocate for in your community.
Awesome. All right. So, Caroline, why do we need ACS CAN members? Why do memberships help us in campaigns like this one?
Sure. So I think the biggest thing is that members of Congress listen to their constituents. I go into offices, well, virtually right now, and I have meetings with members of Congress and their staff, and I can sort of give them the overall perspective as to why cancer research funding is important. But I am not a constituent. I'm not a voter. And so when we have volunteers who, are represented in every congressional district around the country, who can go in and meet with a member or their staff and tell a personal story as to why it's important, like Ian is able to do, that is really impactful, and that makes a difference because suddenly it's not a statistic, it's not the number of people who are diagnosed or die from cancer, it's a person, it's Ian, and for that member and their staff, that makes a huge difference. And that is the feedback we get all the time when we do, we do surveys of staff and members of what is effective and effective ways to communicate. And over again, we get back personal stories from our constituents. That's what we're looking for. So that's why it's so important.
Great. Thank you so much. So we have lots of students watching who are passionate about the fight against cancer. Can each of you say a little bit about your career path and how you ended up working to fight cancer?
Do you want to go first, Ian? Or
Sure. I think that my career path has been almost entirely dictated by the relationships that I've had within the ACS CAN. I've met incredible advocates, and I specifically met with a staff member, and his name is Dr. Mark Fleury, and he is an incredible person with really cool perspective from the organization, and in is his position, I think, is one of the coolest that I've ever seen in a nonprofit organization. And I think I looked at him and I looked at his position and I looked at the people that he got to work with, both volunteers and staff members in an organization like ACS CAN, and I thought, that's what I want to do someday. And I mean, he did his PhD and he did some really interesting things before he came to ACS CAN. And I thought, maybe that's what my career path would look like. And I would really like to do policy next. And I'm thinking about doing a master's in public policy fellowship afterwards, in addition to after my PhD. And so it really has dictated almost entirely what my future looks like. And I think that's by choice. I think that one of the things that, as I said, when you relinquish control after your diagnosis, after that, you really look to define what you want to do and the kind of impact that you want to have on the world. And I think that ACS CAN and learning more about my disease and learning more about sarcoma and getting more involved has been my way of doing that. So, yeah.
And for me, I had been working in politics and legislative policy. I was on Capitol Hill for over 20 years. And my dad died from lung cancer. He had got hooked on cigarettes when he was 9 years old. Tobacco companies got their claws into him. And, to see what he went through and what our family went through, it was devastating. The following year, I had a very good friend who her baby was the same age as my baby at the time, less than a year old, and she died of breast cancer. So I sort of was seeing around me that, you know, people of all ages from all different walks of life were being impacted. People I cared about were dying from cancer, and I wanted to do something to change that. So I saw that ACS CAN was hiring, and I have the best job in the world. I get to sort of work on something that I'm really passionate about every single day. I get to meet amazing volunteers who have stories that I don't forget, and that motivates me to keep going and to try to make a difference. So that's been my career path.
That's awesome. Thank you both for your responses. So is there any upcoming legislation that CAN is excited about in cancer research or support? So I think this is directed more toward Caroline, but yeah.
Yeah, I mean, so we're very excited right now. You know, President Biden is someone in the cancer community. He has his own sort of family story, and I think he understands sort of what it means to be the family member of someone with cancer. It's something that's affected him and the First Lady deeply. And so we're excited to really have the opportunity to work with the President and the First Lady and the administration. And we expect that there could be some announcements around cancer and cancer policy very soon. The president has said that sort of after COVID-19, he wants to focus on cancer and cancer research. So we're really excited about that. I am personally really excited about that. I think it's going to give us an opportunity that we haven't really seen before, to have a president who cares and understands sort of what cancer is about.
For sure. So can you both talk about your favorite ACS CAN win or memory?
Yeah, I can go first. I think my favorite memories and my favorite parts of ACS CAN have always been the stories and the way that the stories can impact legislators. I think that ACS CAN brings together all of these like incredibly kind, genuine, passionate people, and you go through these meetings and you kind of learn about how to use your story, and you might talk about it a little bit, but I just remember like kind of my first meeting sitting with a legislator with all of the advocates from Wisconsin. And all these people I kind of knew as like really bright, genuine people told their stories, and how their stories were impacted by current legislation and how they could be impacted by like decreases in funding or decreases in screening coverage. And it was those personal stories, like that raw emotion that people are willing to bring to those meetings, that really struck me as like, wow, this isn't an organization that brings together people that have an agenda other than like they want to help people so that people don't experience the same things that they have. And I think that just at the core of what ACS CAN is, and at the core of what the volunteers are, is that. And I mean, it's so easy to like fall in love with the other volunteers and like work with them when you understand like that's why they're here. And I think that's one of the only organizations that I've really found that's truly like why they are here and why they do this. And they have heartbreaking stories to back all of that up. And I mean, I think Caroline exemplifies that in her own story. Like, we are all here for a reason, and whether it's, you know, our mother or father, or, you know, for many people that I've met, it's their sons and daughters. And that's just not something that I ever want to anyone else have to go through. And it's, you know, a reason why I'm still here after almost 10 years.
And for me, it's a sort of a similar experience, where I was helping out another organization of cancer researchers. I had two researchers who I was just bringing around Capitol Hill for the day doing meetings, and we were meeting with a member of Congress, and these researchers were talking about their research and why it was important. And the member of Congress turned to me and said, explain to me like I'll understand, why is this important? Why is it important to you? And I at that moment, you know, I wasn't there really to talk, but I could tell the member of Congress wanted to connect. That's what they want to connect. They want it the personal. And so I told how my uncle at that point was battling melanoma, metastatic melanoma. He had been expected to die, and we were able to get him into an NCI sponsored clinical trial, and it saved his life, literally saved his life. And the member of Congress teared up, I teared up, but you know, made a connection, which I think it again just proved to me that you can have all the statistics and all the facts, but it's the personal that matters.
Thank you. So we have one final question. What is the best way to pitch ACS CAN and advocacy in a college campus? And how can we leverage policy to engage new volunteers?
I think the best pitch that I have been given is the evolution of this organization has kind of followed the needs of the cancer community. And kind of ACS CAN understands what disparities in health and kind of the current climate really dictates. And ACS CAN has recognized how they can impact health in all different communities for a very long time. And it was really that understanding and that passion for making sure that the phrase like where you live should not dictate whether you live is really not something that they just say and kind of promote, but it is something that they live by in promoting nonpartisan legislative action that is easy and you can do at any point. You can go on ACS CAN's website and you can take action in your state and on the national level whenever you have time. And you know, kind of just on a daily, weekly, monthly basis, just check out like what's going on in the 3 states that I've lived in and what are the important things that ACS CAN is working on now. And it's just so easy to get involved on that very basic but kind of consistent level whenever I have a free moment, whether it's, you know, during lunch or breakfast or whenever I think about it. And it's also easy to get involved more. If you want to go to local meetings or state meetings, I'm attending my state lobby day and it's easy to go. Generally, they have, you know, in the morning, they teach you how to go into meetings, how to talk to legislators, what those meetings are going to be like, and what the priorities are in your state. And then you have the meetings in the afternoon. And or sometimes it's a 2-day event. It really, you know, kind of depends on the state. But I think that that's a super easy way that I've seen anywhere from like high school to college to adults get involved for the first time and come out feeling like, wow, like today I did something. Today I had a conversation with a legislator about something that I didn't know yesterday. And I felt like I was prepared and I understood, and they came away having learned something about me and a way to change that perspective. So I think that's the best pitch that I can give is just the how well ACS CAN preps you and preps your story and kind of gives you the tools to be successful in a really powerful way.
Thanks a lot, Ian. So we have to wrap up. So we thank you all for giving such insightful information and sharing your stories. And we want to thank the audience for being here. Before we end, I encourage you all to become ACS CAN members by visiting the link below. You should see the banner. And we are running a campus-wide membership challenge. So go ahead and represent your campus by registering. And then ACS CAN needs volunteers like you to make an impact and to drive change in the coming years. We know that advocacy is so important to ending the fight against cancer and supporting those who are currently suffering from it. Becoming an ACS CAN member is the first step at reaching toward this goal. Thank you all and have a great day.